Hello, I'm David Gross, and today I'll be leading you on a path of discovery. We'll be exploring an aspect of life that can be hard to face up to, and oftentimes leads to very challenging questions. As we progress in years, there usually comes a time when we're unable to meet our own needs. We need some assistance. We may have family we can count on, but oftentimes the level of help required goes beyond what family can contribute. This change from total independence that we've become so used to can be scary, and no one likes that feeling of helplessness. So, to aid you on your search for what may work best for yours or your loved one's situation, we've brought together a panel to ask questions to help shed some light on the matter. We'll hear from an actual family physician, getting his thoughts on this, and find out from a professional and medical standpoint what you should be considering. We'll also hear from Emily Chambers. She has an elderly parent who's having more complicated medical issues than she can handle. Also, we'll be checking in with William Ferguson. He's spoken with his physician as well as his family, and he's in the process of selecting a home with the skilled nursing care he's looking for. We'll get his all-important take on the matter at hand. Along the way, we'll hear from the care partners at a local elder care home to see how they address the issues brought up by our panel. Now, without further ado, let's go to our local physician.
In my opinion, whenever you're looking for a skilled nursing facility to go to, there's certain things that you do have to look for. For instance, let's say you just had a hip surgery or a knee replacement and it's something that's planned and you know that you're going to need some rehab. That's exactly what you do, is you take a look at wherever ideally you're going to get the best rehab. You want to look at a facility where they have multifaceted care. They might have the facilities to help if that memory reaches a point in its decline where your loved one might need help with those what we call activities of daily living, which would include bathing that individual, helping that person with their dressing every day, getting their clothes on, helping with personal hygiene, helping with making sure that their dietary intake is appropriate, and helping with meals. You would also like to see a nursing home where if you're walking through, the residents of the nursing home are up and about as possible. They might be in wheelchairs, they might be rolled from one place to the other, but it's nice to see them going to activities, it's nice to see them taking part in a variety of different things, because that tells you that that nursing home has truly taken a vested interest in trying to get that person a good quality of life. And that's probably one of the most important things that you'll see.
With those medical concerns in mind, let's check in with some staff members, also known as care partners, from a local elder care home, Sugar Creek Rest, to see how they meet those all-important medical needs.
Sugar Creek Rest is a continuing care retirement community. Therefore, we have a multitude of levels of care, including independent living, personal care, and skilled nursing. We can make home for over 150 individuals, compromising those three levels of care. The independent living is independent cottages or homes, and the personal care is a 47-bed private room, semi-private room accommodations there. The skilled nursing community boasts a memory care, or Alzheimer's care, memory lane neighborhood, as well as ventilator care in our Serenity Lane, and general nursing home care in our Windcrest Way and Joyful Junction neighborhoods. Therefore, all those three bring together a holistic care or multitude level of care where you can age in place.
What makes Sugar Creek unique? We have physical therapy, occupational therapy, speech therapy. We have a wound nurse and a nurse consult that comes in. We have Alzheimer's secured units. We have bariatric patients. We have ventilator patients. We have short and long-term rehab patients.
Often individuals are hospitalized needing just some short-term therapy in order to be able to return back home. And we offer those services here at Sugar Creek Rest, and we have a very good return to home rate with our therapy. Many residents boast of our therapy department and what they're able to get them to achieve and return to home. Our respiratory therapy has weaned several elders from their ventilator and have been able to return home as well.
We have electronic medical record system. It's easily accessed by the physicians, nurses, medical records department. When they're getting discharged home, their primary care physician will be able to access all the records that were here, all the tests that were done, what medications were changed, and what medications they're currently on.
While the medical insight is so important, we can't forget about the loved one's family and the questions that they have. And for that, we turn to Emily Chambers.
My name is Emily. I'm here to share with you a bit of what I've been going through with my mom. Let me start by saying that my mom is my best friend. She came to live with me about 2 years ago. She moved in when things began to get a little difficult in her everyday life. I saw that I could help her with some of the basic necessities, and it was great. But then Mom began forgetting things. At first it was minor and you could just chalk it up to old age. But then I began to notice patterns of forgetfulness, and it became more serious. She would forget to take important medications, or not know where she was for a minute, and even have trouble coming up with her grandkids' names. So we went together to visit her doctor. And that's when they told us that she was in the beginning stages of Alzheimer's. Much as I would want to be the one to take care of my mom, I know that she was going to need a whole lot more than I could do for her. Now, I'm not the kind of person that can just give up and put their mother in a facility and forget about her. So I made a list of concerns that I have that I need to have addressed before I'll allow her to move into a home. I need to know that the people that work there, the nurses and the other staff, will care about my mom, will listen to her and spend time with her. I need to know that when I go there to visit, I'm going to feel welcome and like I'm just going over to Mom's place rather than to some sterile hospital-like setting. I'd like to know that she can go outside and still be in a safe and secure environment. I need a place where even though I'm not with her, I know that my mind can rest easy and that I don't need to worry about her constantly.
Ms. Chambers' concerns are real. Let's go back to Sugar Creek Rest and check in with not just the staff, but an actual resident to see how their home might meet Emily's criteria.
Sugar Creek Rest is committed to transforming their philosophy of care. They are in the beginning stages of adopting the Eden Alternative philosophy. They're forming their leadership teams, building relationships between the staff and the elders. They're also pursuing much education throughout their home so that everyone understands the goals.
I tell the residents when I first meet them that I work for Sugar Creek, they give me a paycheck, but I actually work for the families and the residents. This is their home and this is how we like them to feel. This is their home setting. A lot of that is having one-on-one relationships with the residents, getting to know them, make them feel comfortable, and coming in they're going to have a lot of different things because they're not used to being into a nursing home setting.
We are called to look at all aspects of the human being, not just their medical conditions or diagnoses, but also we're called to look in their spirit and eliminate loneliness, helplessness, and boredom.
It's a resident-centered approach where the resident directs their daily care or how their day unfolds. They can get up when they want, eat when they want, plan their day out as they choose, as they would at home, kind of just carrying forward those daily habits as well into this community. So you don't have to give up certain things just because you've moved into a continuing care retirement community. You can still plan your day, still do things according to as you choose.
I like to go around, I like to sit with people, just sit down and talk to them. That's the best part of my job, getting to know people, getting to know the residents that we care for, helping them get the things that they like to do.
Within our lifetimes, it's become a different sort of role where we're worrying about compliance all the time. And when you work in an Eden home as a nurse, you have an opportunity to build relationships with your elders and give them good care, rework your schedule so you can sit down and spend quality time with your elders. That's all part of the brand new nursing role in an environment of culture change.
Everything here is fine. They treat you good, and accommodations are good. Since I got here, I love the place, and I know it's going to be my home for the rest of my life.
They have excellent physical therapy. They've got dedicated, they're really dedicated people. I used to walk. They had me walking for years until they just got to where I can't walk anymore. I've had MS for 40-some years. Couldn't talk at one time. My hands were all crippled at one time. They're open now. After your loved one has been here for about 2 weeks, I sit down with them and do a one-on-one interview with them, ask some specific questions that the state has me ask. And during these interviews, I get to know the resident a little bit better, and I get to find out how their memory's doing, how their cognitive skills are. I also ask them specific questions on their mood, so I can see how they're feeling and what's bothering them, and then I can address those issues with them, and I can also address it with the other staff members.
We have a lot of people just in our community that like to come in and volunteer. They like to do the same thing, sit down with the residents, talk to them, read them scripture. I also deal with a lot of residents that like to volunteer.
I love Sugar Creek because they're so good to you. They don't push you off the side if you want to do something or tell you what you can or can't do. And it's really nice. I love Sugar Creek.
I spent 145 days in a hospital in Central Pete. I came here to Sugar Creek Rest August 18th with a trach. I was put on the respiratory unit, and my goal was to get it removed and go home. Well, I'm going home.
Everybody's been fine. The respiratory's fine. The physical therapists, they're all great. I mean, they all remember you too. I mean, they'll come in day after day and hello, and put their arms around you. It's really a great place to be.
Our final panelist of the day has an important view of this whole situation. He's William Ferguson, and he's looking to put a plan in place to help him move into a home when the time comes.
Hello, I'm William Ferguson, but my friends call me Bill. I'm 76 years old, but I don't feel a day over 75. I was talking with my son the other day. He lives out of state, but he came up for a visit. I told him that some things were getting to be a bit troubling for me, and I might need a hand from time to time. He told me he'd get me a butler named Jeeves. I said no. I was serious. I think maybe I better check out my options from here. Now, I'm not too proud to admit when things aren't what they should be, but I'm getting up there, and I gotta know where I'm going. But I also want to make sure it's on my terms. So here are Bill's terms. I want to make my own decisions, like having a choice of what I'd like to eat and when. I want to be surrounded by people who like to do what I like to do. I want to be involved. I don't want to be alone. And I also want to know that I can afford to do these things. I haven't been a burden to anybody for over 60 years, and I don't see why I should start now.
Bill knows what he wants. Now let's see what Sugar Creek Rest has to offer him.
We usually do a lot of outings here in general. We usually have at least 2 a week. We do a lot of lunch and shopping trips combined where we go. We spend the afternoon out. We have a lot of families that actually meet us out in the community and visit with their family, take them shopping, have lunch with them. It's usually a lot of fun.
They have very nice surroundings. They have all kinds of activities, especially bingo. They take us on outings. We've been to the Olive Garden twice. We've been to the casino a couple of times.
We have church services on Sunday. We have a chaplain that works here a couple days a week. He goes around, visits with the residents. We have Bible studies. We have a lot of churches in our community that are involved with our church services.
The kitchen, they're very adaptable to you. If you want something, you ask them, they'll make it for you.
Our culinary arts department have a great dining room. The residents get to come in, they get to choose what they want. They're very flexible in making sure that the residents get what they want. You can let them know up to an hour before and they'll make sure.
I go to bingo if there's bingo that day. I like bingo. Never did before till I come here. It's just the group I'm with in there, bingo. We have a good time, so I enjoy it.
We have several different activities that families, are always welcome to come to. We have a big family picnic in the summertime. We get a huge turnout. We also have a family Thanksgiving dinner that we have every year. Tons and tons of family that come in, good time. We also have a Miss QLS beauty pageant. We have lots of family that comes to that.
And they have ducks and geese, so we go out and feed the ducks. It's a lot of fun. It's just a nice place to live.
I hope we've covered topics that are relevant to your situation. Our goal today was to shed some light on the process of selecting the right nursing home by looking at real concerns from varying points of view. Thanks for your time. I'm David Gross. If you're interested in learning more or touring a local home, then go to www.qualitylifeservices.com or call Sugar Creek Rest at 724-445-3000 to schedule an appointment to take a tour.